Oh. Alright, hello. So my name is Matthias Gelhausen, and I will be talking about my career as an orthopedic surgeon, or my interest in this field. I wanted to address the following. I would like to be an orthopedic surgeon because I think they play a large role in keeping people mobile and able. And basically what I mean is that they help people with any sort of the following problems, whether it be muscle, bone, or joint pain. And ever since I was little, I kind of viewed any sort of doctor as playing a huge role in maintaining society and like what we're capable of doing, whether it be the fact that we're prescribed medicine or something as simple as that. Um, it's just something that I've always been really appreciated of. I really appreciated ever since I was little. And so basically, this is a short job description of what orthopedic surgeons basically do. They're committed to the prevention, diagnosis, and treatment of disorders of the bones, joints, ligaments, tendons, and muscles. So basically, there are like generalists, which basically do it all. Not all, but are basically open to any sort of the following, while others may specialize in the listed areas below. And I actually, speaking from personal experience, I have my own orthopedic surgeon that actually conducted a knee surgery on, or I underwent a knee surgery during the summer of 2018 on July 16th for a damaged meniscus. It was basically a congenital issue with my bone, which meaning it was something that I was kind of born with. So I guess it was something that wasn't urgent, but at the same time they said it should probably be done so that I wasn't having any sort of pain by the time I was like in my late 20s. And the resume based on my career choice, I'm actually going to be passing around a resume. It's a mere mock-up of what my resume would look like if I were applying for the job. The thing on my resume aren't exactly relevant to what the job would ask for, but the format is really what I want to emphasize on. Whether it be like I would list like an undergraduate program or what I'm capable of doing or like my qualifications, any sort of things like that. So the interview wise, I would have conducted an interview with my orthopedic surgeon, Dr. Gallahan, but I have not received a response. I actually emailed a response on Wednesday, but I never got a response. So that's that. This is the salary according to WorkCron. The salaries for an orthopedic surgeon basically are as follows. The entry level is about it's a roughly around the same spot. Whether it's not until you get up into the experience that you start to see a difference in between like the entry, like I guess the not median salary, but like the lowest, I guess is what you could say. And then globally in the UK, they earn about 140,000 pounds, and that is I probably should have made this a little bit more clear, but everything listed for globally is about mid-career, except for Australia. And these over here, actually down here, for Argentina and the Philippines, actually roughly estimate to less than about 350 to $400,000 a year, which is still pretty good, considering that these people. This is a pretty stressful job, if I'm being completely honest. You know, any sort of surgeon. This is something that people really want to have to do because it is something where you're basically holding the life of some people in your hands, and there are cases where people make mistakes and they can prove to be fatal, whether and then the consequences can be as harsh as shutting down a practice or maybe the person beginning to feel a little less comfortable with what they do or what they've chosen as their career. So basically these are the education requirements. Candidates need to complete an undergraduate program for about 4 years of medical school. Basically, after the graduation of all of that, the physician must complete a 5-year residency program, and that includes 4 years of orthopedic surgery training, about 1 year of general surgery training, um, and also pediatrics and internal medicine training following that. And that the American Board of Orthopedic Surgery, or ABOS, ABOS, tests and certifies eligible physicians, and thanks to healthcommunities.com for giving me that information. So basically, this is my educational plan to get to my career. Even though I've not made up my mind entirely, because I did say that I am kind of split as to what I want to do when I graduate from high school. My plan is basically to finish up high school and then possibly go to Wake Tech and take some more classes over there. Complete said undergraduate program after that. Go to medical school, which will take a pretty long time. Anything that really intertwines with the medical field does require a lot of school, a lot of time in school at least. And that's what I've heard from most of my doctors whenever I ask questions about how long it may have taken them to get where they are now. And then after the medical school, trained for a few years, like I said, in the general training, um, the 5 year residency program, all that good stuff. And then I would hopefully after that begin or even start a new practice. And by begin, I mean, I guess that could follow up to this slide, which is the internship possibility. This is before, maybe I'm fully trained. Whether it be, since my job is so, I guess, high risk based, um, an intern possibility as of right now probably wouldn't be the most ideal thing, considering I'm only 16 years of age. Um, I have talked to doctors, like I said, including my own orthopedic surgeon, about my interest in the field, and many of them give me advice, whether it be that I should just stay in school. I have to really want to know that I want to do this because it's something that I have to really invest a lot of time and effort into in order to achieve results to not only better the lives of others, but also, make a good living for myself. And I do plan on searching for an internship when able to find a balance between school and other things, and that is basically referring to maybe when I'm older in the programs or whatever sort of training that I will undergo. And yep, that's about it. Hopefully you looked at the resume. It's pretty great. And thank you.